Thank you all so much for joining us for the Staten Island Partnership for Community Wellness first annual Black Excellent Contributions to Public Health Award ceremony. Just so everyone knows, we are recording. Here's a quick overview of some of the things that we're going to be discussing. Overview of SIPCW and public health. We're going to hear from Nicole Myers, a message from John Yates. We're going to acknowledge all of our awardees, honoring Reverend Maggie Howard, and closing with lots of actionable next steps and ways to get involved with emerging public health issues. And before Jasmine Rivera kicks us off and gets us started, I'm going to do a very brief land acknowledgement. So I'm going to take a few moments to do a brief land acknowledgement and provide a tool that we can all utilize as we discover the history of Staten Island, our birthplaces, and other lands as we travel. If we could all just take a moment to text our state and zip code to 907-312-5085. That number is also in the chat, and Stephen Chan is managing that chat. So thank you so much, Stephen. That app will text back with the information about which Indigenous people's land we occupy. Please share in the chat function the land that comes up for you. Feel free to text in your birthplace or your home if you prefer. The land on which Staten Island stands on is part of an ancient homeland and traditional territory of the Lenape people. We pay respect to the Lenape people's past, present, and future, and their continuing presence in the homeland that we occupy. Acknowledgements are a collaborative process to be formed through continuous relationships with Indigenous people. And acknowledgement begins as a spoken, embodied action. SIPCW is proud to integrate this practice into our work, both internally and externally, with partners and community members alike. We invite you to acknowledge the Indigenous legacy and commit to changing systems of oppression and injustice, taking a step toward health and true equity for all people. Next, I'll pass it to Jasmine Rivera.
Adrienne, I actually think you're up before me. So Adrienne,
okay.
Executive Director.
Yep, thank you. So I'll be playing the part of Jasmine. Good afternoon, everybody. For those of you who don't know me, my name is Adrienne Abadi. I'm the Executive Director of the Staten Island Partnership for Community Wellness, or SIPCW, as we're known in the community. We're so excited to have so many of you here today. For those who are not familiar with the organization, SIPCW is a public health nonprofit that was established to identify emerging health issues and to work with partners to address the conditions that contribute to poor health outcomes. So what does that mean? That sounds pretty jargony. So we talk about public health, and I think people have many different ideas about what public health is. When we talk about it, we're really thinking about the health of communities and populations, right? And it's about prevention and health promotion, and really getting at the systems and structures that have been contributing and holding poor health outcomes in place for generations. So when we think about health, we think about clinical services, and that is definitely a piece of it, and how people receive clinical services is something that we're working on with many of our partners in terms of competence and quality. But the bulk of our health is impacted by what we call the social determinants of health. And I feel like this is now pretty popular. You hear a lot about SDOH, but these are those conditions such as quality and stability of housing, if you have access to food, if it's healthy food, if you have employment and wages, all of these things, and education, quality education, these are things that impact how people are able to thrive in their communities. And when you look at how these impacts of social determinants fall upon communities, we see that it's very unequally distributed, right? And that we see the worst health outcomes depending on race and class. So if we're thinking about systems and what's below the iceberg, We really need to look at like the issues of systemic and structural racism and name those issues. So public health in its essence is about social and racial justice. And we're really seeing this play out with the COVID-19 pandemic, right? The worst outcomes are borne out by the BIPOC community. And I feel like there's now greater recognition and work naming these issues and working to dismantle the systems. So the complexity of these issues are so deep that they require not just any one organization or entity, but many partners working together. And I feel like this graphic illustrates the way that SIPCW works. Like we serve as a bridge between systems and communities to co-create policies and practices, to bring in resources to the partners, to build relationships, to surface things that we're not seeing, and then to shift mental models so that we can really work on system transformation. Since our inception, we focused on improving conditions around behavioral health among youth and young adults, and that's the TISA initiative. We've worked on reducing the burden of chronic disease by improving access to healthy foods, increase opportunities for physical activity, improving the built environment, that's the Child Wellness Initiative. We've been working to connect people with lived experience to healthcare systems, to build the capacity of schools to authentically share power with students, and just really work to support the partners in moving the work forward, right? And that's really the crux of it, that we could not do this work without the partners. People and organizations that span healthcare, education, community and economic development, criminal justice. These are the folks that we need to bring together to work on these issues collectively. And these are the people that we're going to be honoring today. So we're really excited to identify these local heroes. But before we move on to the community, I want to take a moment to recognize Black excellence at SIPCW. So our greatest asset is our team. We are lucky to, and I'm going to try not to cry, but we are lucky to have a brilliant staff whose intellect is matched by their passion for public health and social justice issues. So I just want to take a minute to introduce you to 6 of SIPCW's Black public health champions. And I want to just say that we have recently done some internal reorganization, and staff have received some title changes that are better aligned to their work. So this is our kind of the first time that we're publicly using these new titles. So it's a big reveal too, and we're just excited by it. So I'm going to start with Sarah Blass. So Sarah Blass is our Community Impact and Equity Lead. She has been really leading the work of CWI and addressing chronic disease among communities on the North Shore. She's also the founder of the Staten Island Therapeutic Garden, her own nonprofit working on expanding gardens and opportunities for Staten Island families. She's been leading the work at SIPCW to build our capacity to address racial justice and equity issues and working with our partners. And she's really been quarterbacking this event. Like this has been a whole team effort, but Sarah has been the one who's keeping us all on task. So thank you so much, Sarah, for your work. Next, I want to highlight Marilee DePrenville. Marilee has been with the agency for at least 6 years now, really heading up a lot of our behavioral health work. But now she is the manager of projects and contracts. She is the calm in the storm. She helps us to look through the chaos and develop really elegant and beautiful workflows to keep us thinking at the 3,000-foot level and hitting our marks for our projects. So Marilee, we are so appreciative of you and congratulations. The next person that I want to highlight is Sean Ghazala. Sean is our behavioral health lead. He has been really leading a lot of the social emotional learning activities at SIPCW. His background is in labor and organizing, so we're really appreciative of the perspectives that Sean brings to the work. He's been incredible. And then I'm going to move on to Christina Williams. Christina Williams is the Youth Wins coordinator. She is the glue that keeps all of the partners together. She's super smart, she's kind, and she's a hard worker. And we just love having you here. So congratulations, Christina. And then Jason Pisano. So Jason Pisano is our peer workforce lead, and he's passionate about connecting people with lived experience to programs and employment opportunities. He's just established a peer workforce consortium like Learning Space, and he's super excited by the work, and we love the perspective that he brings to us at PCW. And last, but certainly not least, we have Jasmine Rivera, and I'm pleased to announce that she is now the Deputy Executive Director at SIPCW. Jasmine gosh, there's so much to say, right? She's passionate about behavioral health. She's passionate about data research, maternal and infant health. She speaks fast. She's brilliant. She's great, and she's really helped to shape the organization these past years. So I'm really honored to serve and learn from the whole team, and I'm just thrilled to be a part of SIPCW because of the people and the partners. So now I'm going to pass it to Jasmine, where she's going to talk a bit about our equity journey as an organization.
Thanks, Adrienne. Hello, everyone. Thank you all so much for coming to our first ever award ceremony like this. There are lots of people here in a short period of time, so thank you. So I'm going to take a minute in my quick fashion to just talk about SIPCW's equity journey. So if you're familiar with the tradition of public health, which I'll talk a little bit about what that looks like later, but you really know that oftentimes it's a little bit sanitized when we talk about what really drives health outcomes. So we talk about health equity, we talk about social determinants of health, but we're not always talking about racial equity. We're not talking about heterosexism. We're not talking about the communities that are most affected. And often when we say words like health equity or social determinants of health, it kind of implies that there is like the health behaviors are what's driving those issues, right? If we just get people to stop smoking, then there would be less issues. We hear that a lot during COVID right now. If Black folks smoking and eating unhealthily and getting diabetes is the reason why they're more burdened, which is absolutely not true. It's about the systems and the structures that folks are living and working in. So it's not saying health equity doesn't always encompass these things like environmental racism. So living in a place that has poor air quality, which can affect your lungs, right? Or living in a neighborhood that doesn't have fresh foods and produce. So eating a lot of candy and those things because that's what you have access to. And those things are intentional. Redlining and putting folks in specific communities is intentional. So because we're a public health agency, again, we're found in this language of like health equity, but we have been trying to move along this continuum from health equity to anti-oppression. And we're making the slide, we're like, what do we call that thing at the end? Like, is it just anti-racism? But that doesn't encompass intersectionality. That doesn't talk about LGBTQIA folks. That doesn't talk about other populations, right? So really thinking about what does it mean to dismantle the systems and structures that contribute to and cause poor health outcomes. So just going to give you a few of the top things that we have been doing as an organization and with our partners to try to start to dismantle some of these systems. We really started off with anti-racism training in 2017. It was amazing, felt good, people were excited and charged up about the work, but it didn't translate into practice. And again, like I'm a Black woman doing this work. I feel these things and I know them and I do them every day, but still getting the translation into your practice when you're in a public health world, sometimes it's hard. We work with a lot of partners. It takes a lot of work to push 40 to 50 organizations to change the way that they do work. But this was a starting point for us. Then doing things like the formation of CWI, which was the first project that we had that really called out underserved populations. We were talking about the North Shore, we're talking about underserved, but we still weren't really saying like Black and brown, but we were starting to speak more intentionally about racial equity when we were doing that work. And ballooning up into things like getting involved in courageous conversations about race, which was amazing. The Staten Foundation just funded that for us recently. It was a comprehensive training that we opened up to partners to really start to connect like the ideas of systems and structures and power and racism to like what that feels like and what that looks like among our colleagues. Really powerful sessions while we were together in a room, like looking at numbers and what it looked like for you that have felt oppression, right? And I had a 0, right? That meant I had very little opportunity. Or some colleagues that I love had a 100. So just seeing those things help to expose what racism actually looks like in the systems and the structures. And it's not always about the interpersonal, right? It is often about what is happening around us. So with intentionality and commitment, we are working on these issues in a better way. We're still doing it, we're still learning, and we need commitment from the partners to do this work with us so that we can move towards anti-oppression. And that's just some of the work. And now I'm going to pass it to Sarah Blass again to introduce our elected officials.
Thank you so much, Jasmine. Today, we have Assemblyman Charles Fall, who's going to talk a little bit about what health equity and public health really means on Staten Island. Assemblyman Fall, are you with us? Okay, it seems like he might be having some technical difficulties. So we'll be a little bit flexible with our agenda today. And in the meantime, Marilee is actually going to play a video from Jumani Williams, our public advocate.
Peace, everyone. This is Public Advocate Jamani Williams, wishing a happy Black History Month from my office to the Staten Island Partnership for Community Wellness. I hope we can get to a point where we don't need a specific month in order to accurately reflect and honor our history. But until then, I'm happy to be here and honored to receive your acknowledgement. Black history is not confined to the past. It is an ongoing movement that we are constantly witnessing and contributing to. Right now, sadly, we are witnessing a moment in Black history when our government has again failed to listen to vulnerable communities, seen in disparate suffering from the pandemic and systemic inequities. But while the problems persist, so does the struggle for progress. The visionaries, activists, artists, athletes that work every day to advance the diaspora and this nation. The work goes well beyond February and began well before the United States did. Frederick Douglass, Dr. King, Shirley Chisholm are all part of Black history. So too are George Floyd, Colin Kaepernick, Kamala Harris, and Barack Obama, and so many others. Throughout this time and through it, I'm committed to fighting for equity alongside all of you. Peace and blessings, love and light.
Thank you so much. We're going to be putting his contact information into the chat. So if any of you want to join in some of the public health initiatives that his office has, we can make sure that you're added to the mailing list. Now we just want to make sure that Assemblyman Fall has the opportunity to jump in if he's able to. All right, great. It looks like we're going to pause for that right now. Move on to the next slide. Jasmine, are you ready to introduce our keynote speaker?
Yeah, so now I'm going to introduce our keynote speaker, Nicole Myers, who's the president of the National Council of Negro Women on Staten Island. So Nicole Myers is a strategic initiative specialist with the U.S. Department of Health and Human Services and serves as the current president of NCNW on Staten Island. In this role, she leads several health initiatives, including standing up at the NCNW SI Health and Nutrition Committee, disseminating monthly health tip sheets, coordinating home deliveries of fresh fruits and vegetables, and COVID-19 resources to homebound seniors, coordinating vaccination appointments and transportation to vulnerable populations, and most recently, standing up a monthly COVID-19 educational series that's focused on bringing experts to the table to hold discussions with ordinary folks. Ms. Myers serves on the Curtis High School Advisory Board as a member of the NAACP and Mothers Against Senseless Killing, a volunteer organization focused on connecting families to free or low-cost resources. And now Nicole Myers.
Thank you. Good afternoon, everyone, and thank you so much, Jasmine, for that introduction. And thank you to all of you for attending and helping to commemorate the work of so many. It is an honor and privilege to be the keynote speaker, to give the keynote address today at the Staten Island Partnership for Community Wellness, its first annual award ceremony, as we acknowledge Black excellence in public health. I'd like to start off today with a small story about myself. Born of a mother with an 8th grade education and 3 children by the age of 19, who traveled to New York from the country roads of Mississippi. My mother had very little, came really with a hope and a dream, knowing no one. And she worked hard for her family. We ended up living in Park Hill, growing up in Park Hill, and I eventually landed a job with the Department of Health and Human Services, which I was passionate about, loved it. I grew up on many of the benefits from the Administration for Children and Family. We oversee the Head Start program, the Child Care program, and all these other programs. I just loved the work that was there, and felt like I was contributing. I was definitely playing a role in improving outcomes for children and families by helping to shape the policies within the administration for children and families. But it wasn't until July 17, 2014 that my life really changed. And that was the day that Eric Garner was murdered on the streets of Staten Island. And on that day, I said to myself, I just have to do more. I must do more. I'm not doing enough. And I got involved in every Black organization I could think of, from the NAACP to NCNW to NAN. I protested, I went to DC and protested. I did everything that I could to help deepen my impact for families and communities. And so through all that work, I ended up at the National Council of Negro Women as president just this coming September. And so to give you a little bit about the, and I love the work under NCNW, give a little information about NCNW. NCNW was or is a nonprofit organization founded in 1935. Its focus is on improving outcomes and opportunities and quality of life for Africans, women of African descent, their children and communities. And as a president of this section, I have the distinct privilege of seeing inequalities, the effects of institutionalized racism, and the results of health disparities firsthand. These issues are historical and complex and interwoven in every facet of our communities, from the clinical settings to the elected officials' offices, within the classrooms, and even in the boardrooms of nonprofit organizations. These issues diminish the quality of life for too many and give rise to preventable diseases and intensify mistrust throughout all sectors. For far too long, public health issues have been ignored or exasperated by inequitable living conditions in Staten Island. And we see it in everything. The obesity rates, the asthma rates, the substance abuse, and now, like nothing we've ever seen, pandemic. Public health work is so critically important. The research, the advocacy, every aspect of public health, we must keep an eye on. We have to keep an eye on. And historically, many resources are missing the link that hold solutions together. The community themselves that are affected. My mother would always say, you can't bring a horse. I'm hearing a lot of background, so I hope you all can hear me. My mother used to say, you can't bring a horse. You can bring a horse to the water, but you can't make them drink it. And I would always respond in my head, not out loud to mother, but in my head, I would always respond, who wants to drink dirty water? Because I'm always thinking about, Mississippi and the ponds, and I wouldn't drink dirty water. I think often of that when I think of the services that are built for people without really having them at the table to help inform its design. It's like you're going to build a program for people and you want them to drink it, right? Take advantage of it, and then you don't understand why they wouldn't, but you haven't asked. It is critically important that we stay connected to the people that we are trying to serve and build bridges for and improve outcomes for. We must stay connected to them and let them inform the designs of the services that they need. As a nation, we watch policies lay on desks of decision makers as they celebrate and pat themselves on the back. Again, not designed for the people that it's intended to serve. It's totally unacceptable. But the Staten Island Partnership of Community Wellness is an organization who tirelessly fights to address emerging public issues, coalition building, collective impact, to authentic community engagement, to naming and dismantling racism. And we have to give kudos to all of the recognition that they've already given to their employees. Just today, it's impressive to hear about all the changes that's been made within the organization. And kudos to Sarah for her promotion and all the work that she's been doing on behalf of the communities on Staten Island. Today, I will name each awardee, and as I do, I invite you to really, really think about the work that they've done, right? And think about how you could partner with each of them and help to strengthen and build the work for families. And so we could start with the Staten Island Partnership for Community Wellness, Sarah Blas and Jasmine Rivera and Jason Pisano. And please forgive me, I do not want to butcher up anyone's names. Malari Deprinville, maybe Christina Williams. And we have to give high recognitions for all of the community partners who are being honored today. Some of them are NCNW members. Virginia Allens, hey Virginia, congratulations. That's my NCNW, I call her my advisor. Heather Butts, who is my right hand on this educational series that we launched successfully yesterday, with another one coming up on March 25th, where we're going to be talking about mental health in our communities, the impact that COVID-19 has had in that area. Reverend Robert Perkins, who was one of the 7 Days of Good Trouble Community Collective partners of ours. And I know I'm not going to say all the names, and please forgive me. You all are extremely valuable to this work and public health work. Lee Gar and Taj Ellis, the Muslim Sisters of Staten Island who joined us last night. I want to thank each and every one of you. And I cannot end without giving the highest regard for Councilwoman Debbie Rose, who's always at the forefront of issues of racial disparities. I want to leave us on an inspirational note, a note with actionable items and a pathway to inspire us all. Today, as we learn more about our honorees, reach out to them, volunteer your time, find a category that touches your heart and amplifies their cries for a healthy, equitable community. And it really brings me back to a conversation that a parent had at a conference that I went to. We often say, meet people where they are, meet people where they are, bring the services to the people, meet people where they are. Well, she stood up in an audience of federal workers and state workers and, board members, and she said, I'm not interested in you meeting me where I am. I want you to meet me where I dream. So that's what I'm asking of each of you. Find out the people that you're serving, the communities that you're trying to impact. Find out what their dreams are and meet them there. And don't just give them the resources to achieve that dream. Give them the resources to build their own resources help them achieve their dreams. That's what we need to do. And with that, I want to thank you all for listening to me. And for those of you in this virtual space who are just starting your equity journey, welcome. And work on continuing to deepen your understanding of Black history, of racism, of systemic oppression that interfere with positive health, public health outcomes. Thank you. Thank you all. And thank you, Jasmine, again for introducing me.
Thank you so much, Nicole. That was a beautiful, impassioned speech. And thank you so much for your amazing work on Staten Island and with the federal government. So now I'm going, thank you. And now I'm going to introduce John Yates. John Yates is the Director of Racial Equity and Social Justice in the Office of Emergency Preparedness and Response at the City Department of Health and Mental Hygiene. And John is also currently a JD candidate at the CUNY School of Law. In his current role, John is providing subject matter expertise and emergency response technical assistance to emergency response groups across the DOHMH's incident command structure in order to address racial health disparities within the COVID-19 response and apply an anti-racist framework to the field of public health emergency preparedness and response, which we know is so important. So, John, I invite you now to say a few words.
Hello, everyone. Good afternoon. Thumbs up if you can hear me. Fantastic. Good afternoon. On behalf of the New York City Department of Health and Mental Hygiene, thank you so much for all the work that you all do. Thank you for all the work that the honorees today have done. Congratulations. The work continues, right? I think, especially in modern history, we are encouraged and kind of required to address systemic racism, right? And I think in the New York City Department of Health, Dr. Mary Bassett, who was our commissioner 2 commissioners ago, she really kind of took that initiative head on, and I acknowledge that system level issues require system level solutions, right? And as folks have alluded to already in this event, we can't put the onus on individuals, right? Like we can't say, for example, as it was discussed earlier, we can't say if all the Black folks who are smoking cigarettes, if they stop smoking cigarettes, we're gonna, solve the health issues, because there are other structures in place that kind of perpetuate and fuel, poor health outcomes. And so how do we change that, right? And how do we, fuel ourselves through that journey, right? And I think, I was invited here to really highlight public health heroes, particularly the public health heroes that have passed through the New York City Department of Health. And by no means do I wish to say that, their efforts and their impact and their change isn't meaningful. But what I could not help but reflect on is that in this response, how we've as an agency been working, the majority of our frontline public heroes are Black women, right? In the field of public health, right? We see the majority of the folks up to the task are Black women, right? And so instead of kind of celebrating folks who already have a name for themselves and who are going to continuously be celebrated, as we close out Black History Month and open up Women's History Month in March, I want to acknowledge, right, the Black women who are every day, right, moving and shaking the world and also being humans, right, and also being in life with us, right? And so that's heroic, because life on a good day, sometimes I'm just like, I don't want to get out of bed, especially if I don't have to go into the office anymore. And so I wanted to make note of that. I also wanted to make note of when we talk about Black history, I think, we really try to jam-pack celebration and acknowledgement in these 28 days. And last night, prior to my evening classes for law school, I heard Gay McDougal, who has also been renominated the shortest month indeed, but that's a different conversation for another day. She was sharing her story with the attendees, and what I'm constantly impressed by or like shocked by is that she said, I grew up in Jim Crow South, which means that the Jim Crow South was not that long ago, right? And so when we think about undoing racism and having elders and folks among us who remember a time where this country, where this government saw Black folks as separate and not really ever equal, it fuels the urgency of today, right? And I know folks have probably heard in recent months, right, whether it's Hamilton or Hamilton the musical or in the inauguration, history has its eyes on us, right? And so we are in a crucial time, I think right now. I would offer that we're going through a second Reconstruction era. And with that opportunity, what are each of us doing to contribute to this radical world that we are dreaming of, right? If folks are to meet us where we're dreaming, where are folks meeting us? What do we see the world for us? Oh, I don't know who's ringing for me. I hope that's not a package. I didn't order anything. Right, and so no one's going to give us permission to work for the world that we dream for ourselves, right? And so it is up to us, each of us, right, in these moments in history, while history has its eyes on us, right, to figure out how we're going to stand up today and tomorrow and moving forward to push forward a public health reality, a public health framework that makes room for all of us, right? And when we do this work, when we talk about anti-racism and anti-oppression work, it is all inclusive, right? We are not single or monolithic people. We don't live single issue lives. And so when we are fighting for someone's liberty, it is all the facets of that person. We don't just take their Blackness and say, your Blackness is liberated, but your experience as a trans person is not liberated, right? And so to close, right, and to hopefully encourage you all, it is up to us to make room for folks who aren't invited to the table. And I think it takes how we fuel ourselves in this really long journey is through love, right? And love gives us patience, love gives us energy, love gives us grace. And in a white supremacist Western society, there's often little room for love in our professional lives. But as someone who's committed, I'm going to law school to be a civil rights attorney. I'm working in government because I want to be part of the solution. As someone who is committed to these efforts, I could only do it with love. And so, again, I just wanted to thank everyone for all the work that they're doing, and to remind each and every one of you here that it is up to us to do what we can to create the world of our dreams. So again, on behalf of the Department of Health, thank you so much for having me. Thank you so much for all of your work. Sending you all consensual hugs, lots of positive vibes, and wishing you and your loved ones health and safety. And take care.
Thank you so much, John. That was amazing. Thank you to Nicole and John. Those knocked it out of the park at this first ever Black Excellence in Public Health Awards from SXW. That was amazing. Thank you. So now I'm going to move us, and thanks for framing it this way a little bit, John, about talking about the past and the history of public health. We'll talk for a few minutes about historical figures. And I know we're getting through time, so it wouldn't be me if I wasn't speed talking. So if you go to the next slide, Marilyn. So I'm sure you've heard of some of these folks before, just honoring and acknowledging the work that has happened in public health by Black folks previously. So W.E.B. Du Bois. So W.E.B. Du Bois is a famous historian, sociologist, and activist. W.E.B. Du Bois made huge impacts in the field of public health through his ethnographic research in the Philadelphia Negro and the souls of Black folks. Du Bois and his work paved the way for highlighting the importance of social and health consequences of racism and discrimination against African Americans. So like we spoke about earlier, this idea of racism and discrimination being social determinants of health, W.E.B. Du Bois really highlighted that many years ago. And now we're circling back to talk about those things more intentionally again. Henrietta Lacks, which I'm sure all of us have heard of, was diagnosed with cervical cancer in 1951. When she received treatment, her cervix cells were taken to a lab without her consent, so they were stolen from her. But these cells were discovered to be immortal, right? And again, we've heard this, we've seen the movie, we've read the book, but they're called the HeLa cell line, and it's led to wild biomedical breakthroughs around polio, understanding HIV and AIDS. But what was horrible was that Henrietta Lacks' family was not told that she was directly connected to all these amazing things. And this is the same research institution that also did the Tuskegee experiments. So horrible atrocities against Black folks, but without Black folks, these amazing discoveries would not have happened. And I also want to take a moment to acknowledge that NYU pulled this research together. So thank you, NYU. In our next slide, two more folks that we'll just highlight quickly are Nancy Boyd Franklin. So Nancy Boyd Franklin is a renowned psychologist and writer. She specializes in issues that affect Black families and communities, and she was instrumental in creating new therapeutic approaches that address the mental health of Black Americans and expand treatment options for this community. Her experience in the field led her to the conclusion that therapeutic treatment options for Black families need to be socially, culturally, and economically sensitive. So Mary Lee will talk about this a little bit later, but it's so important that Black folks are connected to behavioral health services, but once there, that they're appropriate culturally, socially, economically as well. And then Joyce Elders is the last person we'll highlight as a historical figure today. So she is a physician and public health official. She was the first African American to be appointed as the Surgeon General of the United States, and this happened in 1993. Before becoming Surgeon General, she worked to reduce the prevalence of teen pregnancy by promoting birth control, counseling, and sex education at school-based clinics. And she also worked on projects to increase child vaccination and screening, availability of HIV services, breast cancer screenings, and care for elderly patients. So again, just taking a moment to honor the public health heroes that came before us. And now we're going to transition into the award categories. So I assigned myself maternal health because I am super passionate about this. If folks know me, two babies that I'm obsessed with. And again, like I understood like logically what was happening around maternal health with Black women before I got pregnant. But once I became pregnant and I started to access services, I could see like, despite education, despite class, despite all these things, you control for those things, Black women are still more likely to die in childbirth. They're still more likely to die after they're home with their babies. Their babies are more likely to die in the first year of life, and we're more likely to develop breast cancer and other cancers. And this isn't, again, about health behaviors. It's not taking care of ourselves. It's about racism in the system. It's about Black women not being heard. That's why it's so important to have advocates, that we advocate for ourselves, but that we have advocates supporting us in this work, and that those folks are also Black folks who understand the struggles. So our first award in this section goes to Shamice Quinn. Let's advance the slide. So Shamice is a community maternal health advocate. Shamice used to lead the perinatal network. And in this role, she was incredibly amazing at really helping folks to understand, navigate services, helping the partners to understand what a huge issue access to healthcare, maternal and child healthcare was for Black women on Staten Island. Shamice is from here and she deeply understands the community and what the needs are and what women need. I have done lots of community events and like conversations with Shamice, and she is down to earth. The women absolutely, and birthing mothers like absolutely connect with her. She's able to get folks to open up and really share experiences, and she's able to help navigate people through tough experiences like loss and miscarriage and like injustice by the system. So thank you, Shamice, for being so awesome and for being such an advocate for maternal health. Our next maternal health award goes to Gracie Ann Roberts. So Gracie is a senior director of maternal and child health operations at the Community Health Center of Richmond. Gracie served in that role for about 4 years, and since her arrival, she's been a strong advocate for improving disparities in maternal and child health. She oversees Healthy Start program, Breastfeeding Initiative, Healthy Women, Healthy Futures doula program, and just the quality efforts at CHCR. I've accessed doula services through CHCR. I know they're awesome. I feel amazing when I go in there. I feel like it's the most culturally appropriate, compassionate care that I've ever gotten. So thank you, Gracie. Congratulations. And thank you for being such an amazing advocate for women and children. And if anyone in this category wants to say anything really briefly, please feel free, or if you want to share thoughts in the chat. So Gracie or Shamice, would you like to share anything? No pressure.
Hi, good afternoon. Can you hear me?
Yes.
I think first, I just want to thank Adrian and the entire team at the Staten Island Partnership for Community Wellness for recognizing the work that's being done at the Community Health Center of Richmond. Jasmine, you did a great job summarizing our services, and you yourself are being an advocate and telling us and giving us feedback on our services. So thank you. That's all that I have to say. Thank you guys again.
Thank you so much, Gracie. And now we're going to move into our next section. Sarah, I think this is.
Next up, we have community healers. I'm really, really proud to talk a little bit about Virginia Allen. Virginia is a lifelong community activist, a registered nurse in New York City at the age of 16. In the 60s, she became a volunteer at the Women's Crisis Center in Port Richmond. She currently is a charter member of the NAACP Staten Island branch, Sandy Ground Historical Society, and active in the Schoenberg Center for Research in Black Culture, just to name a few. She's also known for being the last surviving Black Angel, a group of nurses who saved countless lives during the tuberculosis outbreak. Next, we have Reverend Robert Perkins. Reverend Perkins is a father of 9 and for decades has been involved in a broad range of initiatives that support and improve the Staten Island community. From spending his Thanksgiving hosting dinners for people in need, to his current roles as the outreach specialist for the Fatherhood Matters and regional director for the Edge Foundation. He's very widely known for starting a barbershop in West Brighton in 2001, which was a community healing hub for more than just haircuts. It was also a food pantry, a shelter, and a place where he taught many people how to earn a living. Thank you both for your commitment to Staten Island, and we just want to open it up just in case either one of you would like to share with us today.
I would like, this is Virginia Allen speaking. I would like to thank you very much for recognizing me at this important occasion. And thank you for highlighting the Black Angels and keeping their legacy alive. Thanks again.
Thank you so much, Virginia Allen. Reverend Robert Perkins, would you like to say a few words?
I'm having like extreme technical difficulty, so please forgive me. Thank you all guys. I really truly thank you all guys. It's such an honor. And the biggest thing for me is knowing that y'all guys that's talking about is actually doing the work. And it's not easy doing the work that you give so much for and sacrifice so much for, but doing willingly in spite of how you feel. I definitely appreciate y'all. I got nothing but love for y'all. And God bless each and every last one of y'all. Keep doing the work. My number remains the same. When you need me, I'm there. Thank you.
Thank you so much, Reverend Robert Perkins. Next category, we have building clinical to community trust. Muslim Sisterhood of Staten Island. I can't speak enough about the Muslim Sisterhood of Staten Island. I've had the pleasure of being a part of so many of their events. And they do so much around cultural competency and health equity, from community conversations to having individual conversations with people in the community. They've been instrumental around really destigmatizing COVID-19 testing, COVID-19 vaccinations, and really getting credible information to communities that are often left behind. Thank you so much, Muslim Sisterhood of Staten Island. Next, we have Michelle Heath. Michelle has been a registered nurse for over a decade. She's worked for Test and Trace, and she's also provided direct care for hundreds of patients with COVID-19. She's a wellness fitness coach and a public speaker, and she can also be found volunteering for COVID-19 community conversations to destigmatize COVID-19 testing and vaccinations. She's also the author of the 7 Principles to Becoming Your Own Superhero. We want to just open it up for a brief few moments, just in case Michelle Heath or Muslim Sisters of Staten Island would like to say a few words.
Hi, can you guys hear me?
Gotcha.
Hi,
Can you hear me?
I can hear you guys. Can you guys hear me?
Yes,
Yes.
we can hear you, Michelle.
Okay. I'm just like the Reverend. I have no idea what's going on. It's just one of those days. But I am so honored, and I just want to thank you from the bottom of my heart. Last night I worked, and I was telling one of my nursing assistants, she came out of the room, and the patient, the 2 patients, the COVID room, when we go in there, we need to put on, before we go in, we need to gown up, put on our PPE, our mask. We have a special shield that we use, our gloves, etc. But when you come out, you have to take all of that off. You can't go into a non-COVID room. And she was on her way in because the virus is so tiny and it can be on your clothing, especially if the patients are coughing without a mask, or it's all over the room, right? So I said, wait, don't go into that room. And she was like, what? Why? I said, you were in the COVID room with 2 patients. So listen, it's a very scary thing for everybody. The nurses, the nursing assistants. Sometimes at night you can like lose it a little bit, right? Because it's nighttime, you're tired. But the bottom line is this: we have a vaccine now, and I'm proud to tell you that I finished vaccine number 2, and they just did a new study on it. They found out if you do get COVID after you actually get the second vaccine, studies have shown in Israel that you are either asymptomatic, no symptoms whatsoever, or you have mild symptoms. And the chances of you infecting someone are very slim. So I'm very excited. I'm advocating. I'm doing it. I'm there. I say things. I'm helping. If a patient is COVID negative and the patient who's COVID negative happens to be Black or brown, and they try to put someone in the room who's COVID positive, I stop it. Unacceptable. You will not do that. So I'm out there. I'm doing it, guys.
Thank you so much, Michelle. Muslim Sisterhood of Staten Island, we just want to make sure.
She's trying to fix her mic. 1 second. I'm sorry about that. Hi, everyone. Thank you so much for the honor of this award. It's real humbling, and I truly appreciate the recognition. And my team has been working effortlessly, as with all our partners, to help the community survive this pandemic and beyond. Thank you.
Thank you so much. Next, Darcy is going to take us through the category of physical well-being.
So we know that there are serious racial disparities when it comes to physical well-being in our community, and that's why representation is so important in the physical fitness sphere. And that's why I'm really excited to introduce our awardee for physical well-being, Ms. Omalara Johnson. Ms. Omalara Johnson actually founded AristaFit, which is an organization that provides personal training, group instruction, and executive health coaching services to clients both in person and virtually. She has over a decade of experience in teaching the busiest people how to achieve a healthier life. She has also done a lot of work with our Child Wellness Initiative. And I just have to say, thank you so much, Omalera. We really appreciate you motivating us with your passion and your positive energy and spirit. You are the only reason many of us can get up at 6:30 a.m. to work out. I'm telling you, it wouldn't happen otherwise. And your energy is just infectious. And we're so excited to give you this award. So thank you. So Omalera, you're actually the only one in that category. So if you want to speak, I'm gonna give you the mic. And if not, we'll move on. Okay, we're going to move on. If you change your mind at any point, Omalera, feel free to let us know in the chat. So this next category is one that is near and dear to my heart, youth wellness and education. As we know, there are, of course, a lot of racial disparities when we look at youth wellness and education in our community and nationwide. And I'm really excited to introduce the awardees for this category. They all have extensive experience working in the schools as well as in larger systems. They're all fierce allies when it comes to working with young people and authentically partnering with young people. And we're very, very honored to have them here today. So I'm very happy to introduce our first awardee, Ms. Rebecca Honorou. Rebecca is a young queer hood Black woman, originally from the Bronx, Mount Hope area. She is a loving hood youth advocate as a public health social worker committed to the well-being of Black youth in hoods across the country. She regularly holds space for youth and adults throughout the 5 boroughs of New York City to critique and problem solve about youth serving systems with the Coordinated Children's Services Initiative of NYC. Rebecca is also the founder and lead facilitative consultant of Dream Keep Consulting LLC, which is a consulting firm dedicated to the lives and genius of hood Black youth, holding the people that serve and take care of them accountable to doing the real work and doing it well. Rebecca, you're a force to be reckoned with, and we are so thankful for your dedication to your work with young people. Our next awardee is Mrs. Dr. Marilyn M. Brown. Dr. Brown is a fierce advocate for young people at IS 49, as well as the community as a whole. She promotes spiritual, emotional, and academic education. Her personal and professional expertise comes from her experience working with students with disabilities and supporting their families. Dr. Brown is unapologetic about her Black girl magic, and she definitely leaves a little sparkle wherever she goes. We're so excited to be able to give her this award. Dr. Brown, thank you so much for always telling it like it is and being an incredibly fierce advocate and ally for our young people. Ms. Heather Butts is our next awardee. Many of you know Ms. Heather Butts. She's an assistant professor at LIU, assistant professor in the Department of Healthcare and Public Administration and Public Health Law and Bioethics. Professor Butts is also the co-founder of Health for Youths, which is a nonprofit organization that focuses on college readiness and preparation. Her organization partners with over 53 programs every year to help more than 4,000 students achieve their dream of going to college. And if you're involved in the community and you see any of the community work she's done, like the Clementine Collective, if you see little free libraries around the neighborhood, that was most likely Miss Professor Butts and her young people. Okay, our next awardee is Marquita. So Dr. Marquita Speller has over 15 years of experience as a teacher, school leader, district leader, and executive director. She is the CEO and founder of Ivy Learning Services. And her decision to become an educator was born from a desire to provide equity and access for students of color. She believes that all students can succeed with the right resources and support. And she's also contributed a lot to our Staten Island community through serving as a director of the Equity Alliance of Staten Island. Last but certainly not least, we have Letitia G. Torres, who creates some social emotional learning opportunities for students to gracefully grow into their highest possibility. Letitia's wellness priority is providing access to quality mental health care for BIPOC individuals. Her work focuses on highlighting the vast experiences of Black lives and their right to exist in spaces. Letitia, we really appreciated your work with the Student Wellness Councils, and your holistic approach to health and how much you truly, truly care about the young people you work with and empower them. We appreciate you. Thank you so much.
Okay. I'm not sure if anybody from the category of wellness and youth empowerment want to share any thoughts?
Hi. Hi, it's Heather Butts. Can you see me? I don't know if you can, but I just wanted to thank everybody. I really appreciate it. And I'm at a vaccination pod volunteering, so that's why I have the mask on. But thank you very much. Thank you, SIPCW. And thank you to all the amazing youth that I've worked with over the years who make this work worthwhile. So thank you, everybody.
Hey y'all, I just want to say thank you. As someone that loves children that look like me, that think like me, that talk like me, that move like me, I definitely am very just grateful for the honor. I know I'm a little young and I haven't been everywhere, but holding space throughout the pandemic for community members and youth. Our Youth Advisory Council is actually 20 youth deep at least every single week. So I'm mad excited about that, so that they feel safe and have a space to come to. And this is my cat Prosperity, and she says hello too. So thank you, y'all.
Well, thank all of you for everything that you're doing. So the next category is justice and alternatives to incarceration. So incarceration is a major public health issue that disproportionately impacts Black communities. People who are incarcerated have higher burden of disease and have a greater difficulty accessing employment and housing. Alternatives to incarceration are part of larger criminal justice reform efforts that recognize that systemic conditions that bring people into the system and really try to provide more humane and person-centered approaches. Our two honorees today are both from the Office of the Richmond District Attorney's Office. Oh, I just messed that up. Okay. The first one is Tiana Stowers Pearson. So Tiana has dedicated her career to focusing on strategies addressing a range of race, community, and social justice issues. She's also focused on research and evaluation of policies at the intersection of equity, law, and behavioral health. Tiana is committed to supporting multidisciplinary and interagency relationships dedicated to outcomes that serve youth, families, and marginalized communities. At SIPCW, we've worked closely with Tiana and her team through the HOPE initiative. We've seen her in action. We admire her policy, her research skills, her love of social justice. She is truly a kindred spirit to the SIPCW team, and we treasure our partnership and feel lucky to partner with her. So congratulations, Tiana, today on this honor. The next honoree is Erica Ware. Erica is the victim advocate at the RCDA's office. She is a one-woman show. She serves the victims of the most horrific crimes on Staten Island. She's able to translate lawyer talk into normal people speak, which puts victims at ease, knowing that she'll take care of them. Thank you, Erica, for your efforts to enforce justice on Staten Island. So now pause. I don't know if Tiana or Erica want to share some words with the group, but we're so appreciative of your efforts in supporting communities.
Yes, hi. I just want to say thank you, and I'm honored to be here among all of you guys. You guys do amazing work in the community, and I'm just happy to be a part of it. Thank you so much.
Okay, so now we are going to be transitioning. And I'm going to share my screen. I'm passing it to Marilee.
Hey everyone, I'll be presenting the awards for Champions in Behavioral Health. When we talk about behavioral health, we talk about the promotion of mental health, resilience, well-being, the treatment of mental health and substance use disorders, and providing support to those who are in recovery. We talk about the data, but what we don't often talk about is that Black people in this country are more likely to be exposed to factors that increase their risk for adverse mental health outcomes. We often overlook the specific experiences of Black people in this country, including the trauma of racism, violence, and oppression, and the impacts of those things on their mental health. The historical racism towards and mistreatment of Black people by healthcare professionals explains the mistrust and lack of help-seeking behaviors. Today, we celebrate behavioral health providers across Staten Island that are doing the hard work of meeting people where they are, taking the time to understand the impacts of racism on behavioral health, and providing cultural appropriate treatment. Today, we especially honor our Black behavioral health champions, Erica Onaga, Lee Gar, and Tiffany Watson-Labate. Erica Onaga is the Chief Program Officer at the Community Health Action of Staten Island, a division of Sun River Healthcare. In this role, Ms. Onaga oversees their complete portfolio in outreach, education, prevention, and direct support services for populations most affected by health disparities. Ms. Onaga has a wealth of experience on issues faced by low-income individuals with HIV and AIDS, behavioral health disorders, housing instability, and food insecurity. Lee Gar has worked in the human services arena as an administrator, advocate, case manager, and classroom instructor in the New York City area with individuals, adults, children, and families for over 20 years. Lee currently serves as the Vice President of Community-Based Programs at the Community Health Action of Staten Island. And lastly, we have Tiffany Watson-Labate. Tiffany Watson-Labate has been the Behavioral Health Program Manager since 2018 and working at Curtis since 2014, her alma mater. She is a licensed mental health provider who is passionate about serving youth and adolescents. She believes that there is power in sharing information with our youth and empowering them to be agents of change. Thank you to all of these champions for their dedication and work on Staten Island. I'll leave a little time if anybody have a few words.
Hi, everyone. Thank you so much. This is Erica Onaga. I just want to say that Lee Gar had an emergency and he's very upset that he could not be here. I'm honored to receive this acknowledgement from the Staten Island PCW and honored by the group that I am acknowledged with. Thank you for a community of excellence. And I just know that I have received far more throughout my career than I do. That is my perspective. That's what keeps me going. So there is a little selfishness in here that it enriches me every day to do this work. Thank you.
Hi, and I wanted to say thank you as well. And I know I've worked with a lot of you all in the company on many different levels for the agency. I know I've worked with Jasmine for TISA, Marilee, I think I've worked with you for substance abuse, different things. I've worked with Darcy on youth wellness. So I feel like I've kind of been all over your agency as well. But I thank you for all those opportunities. I thank you for providing those resources. We know Staten Island is very much underserviced for a lot of different things. So having a coalition that is really pushing and trying to get those services to us, I think is really great. So I just appreciate the opportunity to help and support us, and to kind of echo what Nicole said earlier, I think you're meeting people where they're dreaming and you're helping to put that support there. So keep doing what you do. Thanks.
Wonderful. Congratulations again to our honorees. So next we're moving on to workforce. So workforce development relates to public health in a number of ways. Living in a capitalist society, work and the wages and benefits that are earned from work are the means of accessing many of the resources that make for living healthy lives, whether it be housing, food, mental health, etc. So today we honor two Black women who have made it their mission to make employment opportunities accessible to Staten Island youth, particularly Black and Brown young adults on the North Shore. It is my honor to present this next champion and fellow Youth Wins colleague. As Executive Director and founder of the historic Tappan Park Community Partnership, which houses Staten Island's first youth build program, Camilla Hanks has tirelessly worked to make youth development and empowerment through workforce training a focal point of her career. Understanding the needs of our youth, particularly young Black and Brown adults on the North Shore, she has countlessly used her position to advocate for better opportunities and resources for our community. Camilla Hanks is Staten Island's own workforce champion, and we honor her on this day for her outstanding service in workforce. This next person has made it part of her legacy to uplift not just Staten Island, but all of the youth of New York City. She is a real Staten Island hero, and today we honor her countless contributions in the area of workforce development. Debbie Rose is the first African American from Staten Island elected to any public office, breaking down doors for others to follow in her footsteps and excellency. She is Staten Island's youth and workforce champion because through her leadership, we saw her fight for staple programs like SYEP and Work, Learn, and Grow. It is my pleasure to honor this powerhouse and champion, Councilwoman Debbie Rose. At this time, I would like to open it up to the two honorees for workforce to see if you guys want to say a few words.
Debbie wants to go first? Okay. So I just wanted to have big thanks to SIPCW for this beautiful recognition, and congratulations to all the honorees today as we celebrate Black history and as we celebrate each other. I am honored to be recognized, and I'm completely honored to be standing next to Councilmember Debbie Rose, who is a powerhouse in her own right. And so, you know, the work that we do, as one of the other honorees had said, you know, we get much more than we give. And I've learned so much through so many of you and the people on this call. And I just want to thank you all so much. And I appreciate this recognition. Thank you.
So unfortunately, Debbie Rose is not here today, but I'm sure she would like to be. And yeah, so if we can move on to the next section, that would be great.
Sarah, I believe this one's you.
Thank you so much, Jasmine. Many of us, if not all of us, know Reverend Maggie Howard. She was completely instrumental in the lives of so many, from her inspiring words in the pulpit, to feeding the hungry through her food pantries, to advocating for policy change within the community. Today, we are just going to take about a minute to have a moment of silence, and feel free to share some memories of Reverend Maggie Howard in the chat. Thank you all so much. Reverend Maggie Howard, your commitment and your legacy will not be forgotten on the Staten Island community. Next, we have Assemblyman Charles Fall. Thank you so much for joining us today.
Hey, can you hear me?
Yes.
All right, just 1 second. Hold on. Let me just decline the call. All right. Oh, can you hear me? Hello?
Yes, we can hear you, Assemblyman
All right.
Fall. Thank you for joining us.
Great. Thank you so much for having me. I just really want to get on really quickly to congratulate the honorees for all of their efforts, and a special thank you to the Staten Island Partnership for Community Wellness for putting this event together and honoring all the honorees, especially Reverend Dr. Maggie Howard, who I just actually was at the park, Reverend Howard Park, with my daughter, and enjoying that whole experience, and also letting her know who Reverend Howard was, because we did attend her church a number of times in the past. But I just wanted to, come on and again congratulate everybody and thank them for their efforts, and hope to all see you soon. As we're making some good progress, and but nonetheless, thank you, Sarah, for having me, and I'll talk to you very soon. Take care.
Thank you so much, Assemblyman Fall. We'll be putting your contact information in the chat to let people sign up for your newsletters, as well as all of your PPE giveaways. We want to thank you because your office is instrumental in really helping to slow down the spread of COVID-19.
Thank you so much. Thank you so much. And if anybody has any issues or need any more PPEs, let us know. We're here to help, and please share the contact info. We really appreciate that.
Next, we're going to close this out. And for those of you who don't know, we have a few ways that you can help support the next generation of Black public health champions. Our donor box is up and open, and I have a list here of a few people that have donated already, and I just want to make sure that I thank you. Aaron Anderson, Darcy Earn, Jasmine Rivera, Omalara Johnson, and Amoy Barnes. Thank you so much for donating to this. Thank you so much for donating and making sure that the next generation of youth can help to contribute to public health on Staten Island. I'm going to pass it to Jasmine, who's going to close us out for today.
Thank you. And thank you for that reminder. I just passed my baby off so she wouldn't scream in all of our ears as we finished this final piece of. Thank you all so much for coming. This was an amazing turnout for our first event like this. Thank you for bearing with us with technical things. Even though it's been 12 months, I think, of virtual life, we're still getting to know things. Shout out to Rebecca for teaching me about Spotlight View just now. I've been doing this for a year and I still didn't know that. So thank you, Rebecca, again, for being a champion and for knowing how to work Zoom. Again, thank you to all the honorees. Thank you to our keynote speakers for setting the stage so beautifully for us. Like, that was amazing and more than we could have ever wished for. So thank you so much for that. Thank you all for coming. Thank you all for doing the amazing work that you do. We honored some champions in public health, but to me, and if you know about public health and know me, everything is public health, right? Gun violence, everything, everything is public health. So you are all public health champions in your own right. So we're so thankful to all of the folks that make these things happen every day and amazing things. So, and thank you again to all those who donated. If you want to get involved in any of our projects, please reach out to any of us that work at SIPCW. Like we mentioned before, we support collective impact and coalitions. So there are many ways to be a partner to help get some of this awesome work done. Stephen put earlier in the chat the different ways that you can follow us on social media to see that emerging campaigns are coming out and all those other things. And if you're interested in connecting with any of the awardees, you learned about someone that you didn't know before, again, please contact us. You can contact me and we'll connect you directly to those folks. And again, thank you to the staff so much for pulling it together, and special shout out to Sarah Blas. This is amazing. You did such a great job in pulling it together so quickly. Amazing. So thank you all. And without further ado, and last piece of housekeeping, this recording, we are recording right now, it will be available. So we will put it up. We have a YouTube channel, we'll put it up on our channel. We'll make sure to send it out to everyone who registered to that email address. So be on the lookout for an email, and we'll follow up with you with that as well. Any other closing thoughts from anyone else at SIPCW?
Just want to echo your sentiments. We're just so pleased that everybody could join and be part of this important celebration, the first of many, long overdue. But anyway, I'm just so pleased that so many partners could participate today. And I think we're also going to be highlighting folks. We've done a little bit in social media, but maybe we can do links to their organizations and ways that we can partner through our social media campaign. So thank you all, and have a wonderful Friday and weekend.
Just one more quick addition. Sharmila, I know that you are with us and you have a survey in the chat. Do you want to talk briefly about organizations that might need some PPE and how you can help?
Thank you so much, Sarah. You're amazing. This event has been just what we all needed. Thank you for doing this. Congratulations to the team at SIPCW, amazing partners all around, and all the honorees. Yes, the Staten Island COAD, Community Organizations Active in Disaster and Medical Ecosystem, which Dr. Ginny, a big partner of yours, also co-chairs, is on the call today. We have a survey out to assess the supplies, resources, and other needs community-based organizations and efforts have. Please take a look at that survey and complete it. We do have funding to get to you, supplies, resources, and other information that you may need through COVID. So please take a chance. It'll take less than 5 minutes to let us know what you need. Thank you.
Thank you so much, Sharmila, and thank you all again for participating. All of our emails are in the chat, so if you have any questions about today's event, or again, any of the awardees that you heard from today, feel free to email us and we'll follow up. Have an amazing weekend.
Thank you.